if you're watching this video, you are interested in learning a little bit more about Scolibrace modifications. So we're just going to get right to it. Welcome to the clinic. I've got a couple of examples of Scolibraces in here with us today. We're going to talk about one of the most common areas of the Scolibrace that we have to modify for people. It's up under the arms. So if you've got a Scolibrace built for you, whether it's here at our facility or some other location, some other state where you've worked with a different doc on getting a Scolibrace built for you, please take this to heart that I would not recommend that you modify your own brace. Okay, I'm going to show you a few things just so you can understand the concept that they can be modified, which is awesome. It's going to help you to fit better, feel better, so that you can wear it and get the benefit out of it like you should. But please leave it to the professionals. I would hate for you to screw it up and destroy your brace and then somebody having to remake one for you. So when you're first fit for your Scolibrace, oftentimes if your scoliosis drives all the way up high into the thoracic spine, your Scolibrace, to be the most effective, is going to have to get built way up high into the armpit. But if that's an irritant for you, if it's an area of constant nuisance and irritation, please let us know, because sometimes we can modify that a little bit so that it is more comfortable but yet does not lose effectiveness. So for example, on this brace in particular, years ago this was being worn by a patient and his was way up in his armpit, and we were able to trim that down. As you can see, that scoops down, and we were able to trim that a little bit lower to kind of cup underneath the armpit, and then we can use tools that help us round off the edges so that it's nice and smooth and it doesn't cause any problem. And he was able to get along just fine after that, able to wear it every day like he should, and he really got great outcome with it. Another thing that sometimes needs done is adding a little bit of a comfort pad. This is a special type of foam, so don't just stick any old thing up under there. However, sometimes what needs done is for us to add an additional layer of cushion, right, to take away some of the irritation. So we can trim that appropriately, take one of these comfort pads, heat it up and get it to form properly up over the brace, and we can fasten that on with some adhesive and get that all trimmed in correctly so that it gives the patient extra padding under the armpit. And for some people, that's the solution, that's the answer, gets rid of a lot of that armpit irritation. Oftentimes, just trimming it down will do it. So I want you to take away from this that now you know they can be modified. In fact, we can even superheat this polymer, this plastic, and get it to become flexible again and reshape and remold, just slight modifications to the curvature up under the armpit to help not drive into the arm up underneath quite so badly. So now you know they can be modified, which is awesome. So if you have a Scolibrace or you're looking into it, just rest assured that if you're having irritation in any place, just be in good communication with us or your Scolibrace doc so that we can be making the appropriate alterations and modifications to it to get you the best outcome. So have a great rest of your day, and if you have any further questions on that, always feel free to reach out.